So hello everyone and welcome to this very important session on a very important artifact that is frequently encountered during Doppler imaging, that is aliasing. I'm sure you all must have encountered aliasing during spectral Doppler. So now we'll discuss what exactly aliasing is and how to reduce it. So we'll try to understand this topic with its practical application. So here we have a radial artery Doppler waveform of a 30-year-old male where we can see this artifact very well. The peaks are seen below the baseline and we cannot measure the peak velocity very well in this waveform. Now I did something in the settings because of which the waveform is now seen very beautifully and all the peak systolic velocities can easily be measured. Now what I did and how to remove this particular artifact, that is what we'll be discussing later in this video. So we'll start first with understanding what aliasing is and why does it occur. So aliasing is a phenomenon inherent to Doppler modalities which utilize intermittent sampling, that is pulse wave Doppler rather than continuous Doppler, in which insufficient sampling rate results in an inability to record direction and velocity accurately. So as we have seen in our example previously, that the velocity could not be recorded accurately because of that aliasing artifact, and also the direction could not be assessed very well because the peaks were seen below the baseline. So to understand why aliasing actually occurs, we first need to understand the basics of Doppler image. So start with what exactly is Doppler effect or Doppler shift. So to put it in simple words, it is a received frequency minus the transmitted frequency. So Doppler shift or effect is defined as change in the frequency of the sound due to a reflector moving towards or away from an object, which in our case is the probe. So when the RBC, that is the source, is moving towards the transducer or our probe, there is a positive Doppler shift. When it is moving away, there is a negative Doppler shift. So positive Doppler shift is represented by red, while negative Doppler shift is represented by blue. So to discuss this further, when a sound of a given frequency is discharged and subsequently reflected from a source, that is the RBC, that is not in motion, the frequency of the returning sound waves will be equal to the frequency which was emitted, and hence there is no Doppler shift or Doppler effect occurring. However, if the reflecting source is in motion, that is the RBCs are in motion within the blood vessel, either towards or away from the emitting source, that is the ultrasound transducer, the frequency of the sound waves received will be higher or lower, that is positive Doppler shift or negative Doppler shift, than the frequency at which they were emitted respectively. So a positive Doppler shift occurs when the frequency of the received ultrasound waves is greater than the frequency of the emitted ultrasound waves. The source reflecting the sound waves is moving towards the transducer, which is depicted in red as I showed you in the previous slide. The spectral envelope in the continuous or pulse wave Doppler will be above the baseline in a positive Doppler shift. When in case of a negative Doppler shift, the frequency of the received ultrasound waves is less than the frequency of the emitted ultrasound waves. And the source reflecting the sound, that is the RBCs within the blood vessel, is moving away from the transducer, which is depicted in blue. And the spectral envelope is below the baseline. So coming to this very important Doppler equation, which helps us calculate the velocity of the blood flowing within a blood vessel because of the Doppler shift or Doppler effect. So Doppler shift or Doppler effect is equal to the received frequency minus the transmitted frequency, which is equal to 2 into the received frequency into V, that velocity of the blood, divided by C, the velocity of the sound within the medium, into cos theta. Theta is actually the Doppler angle, that is the angle between the ultrasound beam and the axis of the flow. So the Doppler formula is used because the transducer is not parallel to the axis of the moving object. It is not parallel to the axis of the moving object, and the maximum Doppler shift occurs when the relative motion occurs at a Doppler angle of 0 degrees, that is cosine 0 is 1. And no Doppler shift will occur when the motion of the reflecting source is perpendicular, that is if the probe is kept perpendicular to this blood vessel, this cosine of 90 is 0, hence there will be no Doppler shift. So coming to the very important question, at what angle should we keep the probe to get the best results? So it's generally 30 to 60 degrees. Very low angles cause refraction, and after 60 degrees, even a small error in the angle causes a very large error in the estimated velocity. As you can see in this graph, after 60 degrees, see the slope of this graph. These are the velocities. So after 60 degrees, even a small change in the velocity can lead to a large error in the estimated velocity. So velocity can be derived from this equation like this, that is the Doppler shift, which is calculated by the machine, into c, that is the velocity of the sound within the medium, which is constant in soft tissue 1540, divided by 2 into transmitted frequency, which we can control, and the cos theta, which is again in our hands. So coming to our initial important question, why does aliasing actually occur? So to understand why it occurs, we first need to understand what is Nyquist limit. So it's a very, very important concept that we have to remember to understand aliasing. So if you want to take home something from this particular presentation, I would suggest just look at this particular slide very well and remember it. Because whenever the concept of aliasing is discussed, Nyquist limit has to be remembered. So Nyquist limit represents the maximum Doppler shift frequency that can be correctly measured without resulting in aliasing in color or pulse wave Doppler. So our sampling frequency, that is our pulse repetition frequency, should be double the maximum Doppler shift to measure this particular Doppler shift accurately. So this is the equation of Nyquist limit. That is, maximum Doppler shift should be equal to half of the pulse repetition frequency, or our sampling frequency or pulse repetition frequency should be double that of Doppler shift, maximum Doppler shift. So what exactly is pulse repetition frequency? So in our pulse wave Doppler, what exactly this is the waveform that is seen in a pulse wave Doppler. That is, we send a pulse and then we listen, and then we again send a pulse and then we listen. So the time that is taken from one pulse to the starting of the another pulse is called the pulse repetition period. Pulse repetition frequency is inversely proportional to pulse repetition period. Pulse repetition period can again be represented by 13 microseconds into d, that is depth of that particular vessel. So substituting all this into the Doppler equation, we get this particular equation to calculate the maximum velocity in the vessel. So coming to our second most important question, how to reduce aliasing? So these are the 6 ways by which we can reduce aliasing, and the explanation to all these ways are within these equations. So we can either decrease the depth of the vessel that we are imaging, that is, at a shallow area we can image that particular vessel, which decreases the pulse repetition period. That is, by this equation we can see that decreasing the depth decreases the pulse repetition period, and decreasing the pulse repetition period increases the pulse repetition frequency. Pulse repetition frequency, when it increases, we can measure this or calculate this maximum velocity. Increasing the PRF directly, we can directly increase the pulse repetition frequency. We have a button in our ultrasound machine which directly increases the pulse repetition frequency, by which we can actually calculate the. So whenever we see this particular aliasing, we should rather try to increase the pulse repetition frequency directly so that this aliasing disappears. We can adjust our baseline. This can be done when this particular aliasing artifact does not cross the baseline. If it crosses the baseline, you have to adjust the pulse repetition frequency. Otherwise, you can adjust the baseline and then see if it actually corrects. We can decrease our transducer frequency. We can use a lower frequency probe to reduce the Doppler shift itself. Reducing a lower frequency probe reduces the Doppler shift itself. We can increase our Doppler angle also. Increasing a Doppler angle decreases the cos theta and hence decreases the Doppler shift again. But this is at the expense of inaccurate velocity measurement, as I already discussed, increasing the angle. We can switch to continuous wave Doppler where there is no pulse repetition period or pulse repetition frequency, and hence no Nyquist theorem.